Know that you have so many people that want to talk to you, and for good reason, because you gave an incredible session on AI and wearables. Do you mind introducing yourself?
Hi, I'm Paul Friedman. I'm Chair of Cardiovascular Medicine at Mayo Clinic in Rochester.
It's very nice to meet you, and we're honored to have you talk with us a little bit about your session. You said something very profound about how our bodies contain all of this information that's encoded within us, and AI has really helped us to gain more insight into the human body. Can you kind of elaborate on that?
Sure, we found that by adding artificial intelligence analysis of images and signals that we often record, ECGs, echocardiograms, we can learn so much more about our bodies, both their normal and abnormal function. So some of the examples we discussed is the ability to detect, for example, ventricular dysfunction reliably from a 12-lead ECG. We've shown that you can also do it from a wearable, from a single lead. There are a lot of important open questions though. How do we best use that in a way that helps patients, in a way that makes sense both medically, economically, societally? So one of the big frontiers not only is continuing to develop the tools, but to sort out the implementation science. How do we best use the tools to achieve the goals we want to achieve? There are also gaps in the evidence base, but some of the things that are emerging are absolutely remarkable, stunning. One example that I really find amazing is the ability to take a single frame from an echocardiogram, it's not moving at all, and to analyze that, and AI can tell us what the ejection fraction is. It seems amazing, but when you think about it, if someone has depressed ventricular function, we know there are pathophysiologic processes in those cells. And when we interrogate them with ultrasound, the backscattered signals is picking that up. And even though it's too subtle, the analysis of the texture of the backscattered ultrasound from the walls of the ventricle is inadequate. Maybe if there's a big aneurysm or something more telling, but often even without that, the AI can identify it. It can also identify the age and the sex of the person. So I think there's a lot that will, as we learn to use these tools, make us better clinicians.
I think it's really incredible, and it's relevant to pretty much every field of cardiology and medicine in general. How do you think we as physicians can adapt to embrace AI in our future?
Yeah. So the role of physicians is central to this process. We, number one, have to ask the critical questions. Does it work? Does it work well? How should we use it? Maybe even before that, the tools are increasingly powerful, but what questions do we need to solve? We have very talented AI scientists and engineers who can do amazing things, but it's a partnership where we say, look, here's the problem I have. I'm under-detecting this disease, and we have treatments for it once I know it's there. So that's where I gave one example is after anthracycline chemotherapy. Patients are at lifelong risk for ventricular dysfunction. And so an effective screening tool in that cohort makes sense. Peripartum cardiomyopathy may affect 3 to 6% of pregnancies. We have treatments. Young person at risk. These are things where we have a lot of opportunity, I think.
I think it's a beautiful point you bring up about the collaboration between multiple disciplines to make incredible advances in medicine. And so it's really exciting to see your work. I do have to ask you, how did you get interested in this space? What drew you into the world of AI as a clinician?
I'm an engineer by background, and I was traveling and met with some engineers from Israel, and we started talking. They were asking me about the problems I was facing, and they're like, oh, there are engineering solutions for that. And we started doing research together, actually probably back in 2010. And ultimately, the tools caught up with some of the questions we were asking so that we could really begin to answer them, because the AI capabilities have really exploded over the past few years, as we've all seen in our day-to-day lives.
That's incredible. So you really are the bridge between the worlds. It's incredible.
There are many people in that bridge, but I feel privileged to be part of it. It's really been an exciting area.
And we're honored to benefit from your wisdom. One last question for you. When you're not working on all of these other things that you showed on that slide of what keeps you busy in the lab, in life, what do you do outside of cardiology that lights you up as a person?
So completely outside of work?
Completely outside of medicine.
Sure. Well, I'm married. I have kids and grandkids, and my wife and I love to travel, meet new people, try new experiences, and we both love to read and watch foreign films.
That's incredible. Thank you so much for sharing that with us.
Yeah.